So, Shan, what is the evidence for topical antimicrobials in wound care?
So, Peter, different topical antimicrobials have been researched to varying degrees depending on the type and product. Some topical antimicrobials have been researched more than others. So, there's quite a lot of research, for example, around the use of silver in wound dressings, wound care. Despite the research evidence that we do have, though, there is not a lot of robust evidence around the use of silver in relation to wound management outcomes like wound healing.
So when should we use them then?
So it's really important if you're considering introducing a topical antimicrobial into your management plan. So I think there are a few questions that you need to ask yourself. Firstly, we still need to do a really comprehensive patient and wound assessment to understand what the causative factors are for that wound being there in the first place. We need to have some idea about what we want the topical antimicrobial to achieve for us as part of our management plan. So, is it wound healing? Is it odor management? Is it a combination of all of those things? So, actually, what do we want from the product? The other thing we need to think about is the mechanism of action of the topical antimicrobial. So they don't all work in exactly the same way. So again, if we use silver, for example, some silver products will deliver the antimicrobial or active silver into the wound bed and work that way. Other dressing products that use silver, the silver is retained in the dressing product. So there's no interaction between the antimicrobial or the silver and the wound bed. It stays inside the wound care product. So we need to understand the difference in mechanism of action when we're making decisions about when to use them or if we're going to use them. The other two things that are really important there, one is cost. So these products are quite expensive. So we need to consider whether there is a cheaper alternative that might give us the same outcome. And duration of treatment is a big consideration as well. So I wouldn't be using a topical antimicrobial for any longer than 2 to 4 weeks, because that would be enough time to give you an indication as to whether or not it's having any effect.
Okay, so can we use them to treat infection?
So, topical antimicrobials are not generally designed to treat active infection in isolation. So, any infected wound needs to be assessed comprehensively for the need for oral or systemic antibiotic therapy. We might consider using a topical antimicrobial as an adjunctive treatment or in combination with antibiotic therapy, but they are certainly not designed to treat active infection in isolation.
Thanks, Shan.